my name is Madison Laminack and my course ID number is 3382716, and I'm taking the fall semester in 2019, and I'm taking VTHT 1301-31425. To safely handle a large dog during lateral saphenous venipuncture, you're going to want to hold the dog close to your body like this, and you're going to want to reach down and over the dorsal and slide the dog down. So I'm going to show you how to do that now to put the dog in lateral recumbency. So you're going to want to hold the dog close to your body like I said, reach over the dorsal, which is the back part. You're going to want to grab the back legs and carefully slide the dog down onto the floor like so. So lateral and lateral recumbency means away from the midline, and recumbency means lying on a surface, in this case the floor, because she is a large dog breed. But if you are restraining a small to medium dog breed, you're going to want to use a table. So, and then to start the restraint process, I'm going to apply pressure to the neck and basic skull area, and I'm going to keep hold of the front leg like so. Now, the lateral saphenous vein is located above the plantar and the tarsus in the lateral aspect of the distal tibia. So to occlude the vein, I'm just going to squeeze just above the stifle to occlude the vein, and as you can see, it pops out right here, just right there. So after the blood is drawn, I'm going to apply pressure to the site to avoid any hematoma that may occur, and that is basically when a blood vessel is popped. So after a minute or so, I'm going to release the restraint and just make sure she's comfortable so she can just relax. To safely handle a dog during cephalic venipuncture, you're going to want to keep the dog as close to your body as possible, and you're always going to want to have control of the head. So to start, you're going to want to either use verbal restraint by telling the dog to sit, or apply pressure to the caudal surface and then slide the legs down. So I'm going to show you that now. So you're always going to want to have control of the head. So I'm going to apply the caudal surface pressure, and then slide her legs down like so. Like I said, you're always going to want to have control of her head. Sternal and sternal recumbency means lying on the belly, and then recumbency means the act of lying down. So to start the restraint of the cephalic venipuncture, you're going to want to place your hand underneath the elbow and then your thumb on the dorsal surface, which is the top. To occlude the vein, you're going to want to grip and roll from medial to lateral, and the vein, as you can see, occludes right there. Okay, so the cephalic vein is located on the dorsal surface between the carpal joint and the elbow, so it's just right here. So after the blood is drawn, you're going to want to apply pressure to the site to avoid any hematoma that may occur, and that's just basically a popped blood vessel. So after a minute or so, that should be okay, and then you're just going to want to give the dog comfort so she can relax. To safely handle a cat in medial saphenous venipuncture, you place the cat into lateral recumbency. So you would slide the cat down on its side, place the head up with your hands like this, and then you would support his backside with your arm. So I'm going to show you now how to place a cat into lateral recumbency. So like I said previously, you lay the cat down on its side, you place the head up like this in your hand while supporting the dorsal, which is the back. And so now you would take the back legs and hold them like this. So lateral recumbency, the lateral means away from the midline, and recumbency is lying down on a surface, which in this case is a table. So like I said before, you would take both legs like this, and at this point, the cat is ready for blood to be drawn. So the leg would be taken out like this, and the medial saphenous vein is located in the medial aspect of the leg. So to occlude the vein, I would need to apply pressure in the inner thigh like this. Okay, and after the blood is drawn, I would slide my hands down just like this to wait for the blood to be clotted. It'll take about a minute or so. And after the blood is clotted, you would release the cat to relax. To safely handle a cat during cephalic venipuncture, you're going to want to keep the cat as close to your body as possible. And I'm going to be using the scruffing technique. So I want to show you that now. So when you place the cat down in sternal recumbency, you're going to make sure he's on his belly. Just carefully place him down. You're going to always want to have control of the head. So sternal and sternal recumbency means lying down on his belly, like so. And recumbency is lying down on a surface, so in this case, a table. So we're going to want to make sure he's on the very edge of the table. So now I'm going to show you how to restrain for the cephalic venipuncture. So you're going to want to present his foot. You're going to want to scruff, pointing his head away from the cephalic venipuncture site. You're going to want to present his foot with your thumb above the elbow, and you're going to want to grab and roll from medial to lateral, and that is going to occlude the vein. And the vein is located between the carpal joint and the elbow. Now, once the blood is drawn, you're going to want to apply pressure to the site, back up the cat, so any hematoma will not occur. Basically, that is when a blood pressure bursts, when the artery bursts. So after that, you just want to carefully release and then relax.